big cities, small towns, rural areas, urban, and that's really what we need to build this movement. And so now I'm thrilled to welcome Dr. Abdul El Sayed, who is a physician, epidemiologist, public health expert, and progressive activist, and contributor at CNN. And he's written books, including co-authoring a book, Medicare for All, A Citizen's Guide. So Dr. El Sayed, to close us out, can you share some thoughts for grassroots activists on the pandemic and how you think we can continue to build this grassroots movement and in the coming months and in the future?
Absolutely. Well, first of all, thank you so much for having me. Really excited to be with you all today. I want to just give us some context. The COVID-19 has found its way into the crevices of American healthcare in some pretty profound ways. Number one, the dangers of tying healthcare to employment when people are losing their jobs left and right. Number two, the fact that we have hospitals that are reliant on reimbursements from elective procedures that then get canceled in the context of a major pandemic, who are now fighting a pandemic and fighting bankruptcy at the same time. And then number three, the fact that 10% of our population, who tended to be the most underserved and the most at risk, didn't have healthcare in the first place. And even if they did, 50% of people won't have the paywall rescinded. That is their deductible. I mean, if you think about it, a deductible is a paywall for the healthcare you already paid for. That paywall doesn't drop until May 19th, which, you know, the Kaiser Family Foundation calls Deductible Relief Day, the day when the median American pays down her deductible. And so it's shown us how broken our healthcare system. The fight for Medicare for all does not end. It cannot end. And it never was one candidate, as much as that candidate has done so much to advance the ball down the field. So I want folks who worry that that fight has been put back, just to take heed from all the incredible grassroots activists who've been fighting that fight on the ground in their own community, including Lauren. I don't know if she's still here, but, you know, thank you for all the work that you've done. And I was really glad to be able to work with her when I ran for office in Michigan in 2018. And so that fight continues. It just takes a number of different forms. I want to be clear about a couple of things. The unitary fight for a single payer healthcare program across the United States and across individual states, that cannot end. That has to continue forward. But when we think about where we sit between now and in November, I don't want us to forget the fact that we are dealing with a pandemic that has killed 100,000 of our countrywomen and men, that it has fundamentally devastated our economy, and that is because of the failure of leadership that we have seen at the federal level. And so I want us to remember that when we think about where we head from here, even if the stated aims may not be Medicare for all, let's not forget that we have a responsibility to fight for the values that we stand for, and to make sure that even if we're not playing offense on the issues that we want to see done when it comes to American healthcare, passing Medicare for all, sometimes you got to play defense. And, you know, I always tell folks that I would rather be fighting for Medicare for all in 2021 than fighting against ACA repeal. I'd rather, you know, in beyond healthcare, I'd rather be fighting for real immigration reform than fighting against a wall. I'd rather be fighting for a Green New Deal than fighting against the repeal of climate policies that are currently on the books. And so I think we have a real responsibility to leverage this moment to realize that, you know, it may mean that we go out, you know, to use a crude football analogy, we kick a field goal and we come back and aim for a touchdown on the next drive. I want to say, though, that, you know, activists on the ground, as we think about where we need to go from here, let's not forget to bring it full circle what COVID-19 showed us regarding our health system. And let's not forget to focus on those issues as we advocate for why Medicare for all is one solution to many problems, whether it's the lack of resilience in our healthcare system, whether it's the failure to protect people from the loss of their healthcare if they lose their employment, whether it's the fact that when you force people to pay for healthcare, you are going to, by definition, exclude people from coverage. All of those things are solved if we were able to move forward on Medicare for all. You all are doing that work every day. I'm really, really grateful to be able to walk that path with you, and let's keep going. That fight never ended. It will continue until in this country we have finally dignified the value of our fellow countrywomen and men by guaranteeing them the fundamental right to healthcare. And that fight is worth fighting every single day.
Thank you so much, Dr. El Sayed, who is just a giant in our movement and working at many different levels. And so thank you so much, and for taking the time to inspire the grassroots activists who are doing this work at the local level. So thank you so much. And once again, I just want to say, you know, we've covered a tremendous amount of ground this evening, from Congresswoman Chu to Council Member Williams, Dr. El Sayed, and the amazing activists who are doing the work at the local level. But we always try to, and Marty Garza as well, try to highlight both the importance of the movement building and the expertise and the importance of our political leaders taking stands that they need to take. And so while we're really trying to make sense, I think, of these confusing times and what all of this means to us, I think what's clear from tonight and what we've been hearing from everyone across the country is that our commitment to one another and this movement really does remain strong, that we're resilient. We're coming up with new ways to connect virtually in our communities, to hold our elected leaders accountable, to counter the misinformation that's being spewed by industry about Medicare for All, and to care for those who are most vulnerable in this crisis. So I've been thrilled to see the engagement that everyone's had on the chat and the connections that people are making during this webinar and beyond. And I'm grateful to each and every one of you for joining us this evening and for being a part of this movement. We will continue, we'll be having our next webinar in 4 weeks, which Thursday, June 25th at the same time. And if you want to give an update on an upcoming webinar, please let us know. And again, thank you to Congresswoman Chu and Council Member Williams for joining us and for being a part of this. So thank you very much, and we will look forward to being in the trenches with all of you. Thanks so much.
Bye.